There's a critical need for hospice volunteers. Here's my pre-recorded conversation with North Mississippi Medical Center. New at noon, you have the chance to make a difference in a terminally ill patient's life. In fact, the North Mississippi Medical Center is looking for hospice volunteers right now, and joining us to tell us more about this great need is Sandra Gordon, the Volunteer and Bereavement Coordinator. Thank you so much for joining us.
Glad to be here.
So tell us, when it comes to hospice patients, why is there a critical need for volunteers?
Oftentimes the patient and the caregiver are closed in and don't get out, and they need that socialization from the volunteers and need that contact, and the volunteers can do so much to help them out and keep them going as long as they can.
And when it comes to volunteering, what is it that that you are looking for them to do?
We have lots of things the volunteers can do. They can do some respite sitting with the patients, and that gives the caregiver a chance to get out of the home or out from the hospital. They can sit in with the patient, sing to them. They can read to them. If they're working on the unit, the inpatient unit at the hospital, they can fix the snacks for them. They can put charts together. There's a lot of different activities they can do.
That sounds very important. Also, when it comes to being that volunteer, what kind of background checks, if any, that you do just to make sure that everyone is safe?
We do a background check, and they are required to have a flu vaccine, a TB skin test, also the first 2 COVID injections they are required to have, and like I said, they do the background check. We do a thorough, so we want to make sure we have good volunteers.
And when it comes to COVID, have you noticed that volunteering has gone down because of the pandemic?
Prior to COVID, I had about 30 volunteers. Now we have 9 active volunteers, and we're working to build that back up because we need the volunteers. The patients need the volunteers, and the caregivers need them. So we're working on that.
And for our viewers actually watching this, what message do you want to actually tell them how they can impact this person's life?
You can make it's so worthwhile. You can make such a difference in their lives. I tell people often it's just like visiting people from church. You just go visit with them and socialize with them, and you brighten their days, and they need it. They need it at end of life. They need that contact.
And we are running out of time, but can we show the phone number that people can be able to call to volunteer? And that's that number there on the screen. The number is 662-377-3296. They're going to call this number, and what is the process?
When they call this number, we'll set up with them a day that we can do some volunteer training, teach them about hospice, the philosophy of hospice, get them set up with employee health for those things I had talked about previously getting done, and then we'll get them all cleared with their background check and get them started visiting patients.
All right. Thank you, Sandra Gordon, joining us this afternoon.
Thank you.